Hello friends, today we are going to get introduced to the subject anatomy and we will see how should we learn anatomy. So let's start with the question. What is anatomy? Anatomy is the subject which deals with the organs of our body. It will help you in identify and describe each organs of your body. Now, in the first year of MBBS, we are going to study anatomy in different divisions. So, first of the division is general anatomy. General anatomy will introduce us to the various anatomical terms, and it is going to be the base of our anatomy study. Here we will learn many terms like what is sagittal plane, what is flexion, what is adduction, what is circumduction, and many more. We will further study anatomy as gross anatomy. Gross anatomy deals with all our organs like brain, lungs, heart, kidney, stomach, all organs. Here we will study muscles, nerves, vessels like arteries, veins, lymphatics, and many things. So, gross anatomy is further divided as a study of upper limb, lower limb, thorax, abdomen, and head and neck. Then we will further study anatomy as neuroanatomy, which will deal with our anatomical study of nervous system. Here we are going to study the brain, spinal cord with very long description. Another subject in anatomy is going to be histology. Histology is the study of cells, tissue, organs at the microscopic level. Another part is osteology. Osteology is the study of bones. We will study all the bones of human body, that is all 206 bones we are going to study individually. So now let's see how to study anatomy. The first and foremost question is, which book should we use? Mostly for anatomy, most of the students are going to use B.D. Chaurasia. It is a complete book for anatomy. Another book is Vishram Singh. There are other books like Atlas, Gray's Anatomy, but I advise you that don't purchase the book immediately. First see which books are used in your college. And what should you do? You should buy any of the one, mostly B.D. Chaurasia as a hard copy. Rest books you can get it from library or as a soft copy. So now let's see how to study each division of anatomy. Let's begin with histology. Friends, histology is not the subject of theory. In case of practical exam, you are going to have to identify the slide. And for theory, you have to go for the drawing of the diagram which you are going to see in slide. So, to study histology, you must go for the distinguishing features so that you can identify the slide. To identify the slide, mostly we should see the epithelium, whether it is columnar, whether it is simple or stratified, squamous, cuboidal. That will give you the idea to identify the slide. You can see that if it is having fatty tissue, then in hematoxylin you are going to get some empty and blank space. In case of lymph node or lymphatic tissue, we will see the purple spots, so that it will be useful in distinguishing spleen, lymph nodes, etc. Then what you should do is you should try and practice to draw the structures which you are seeing or observing in your microscope. This is how you can go for study of histology. For osteology, when you are reading the stuff of osteology, you should have your bones with you so that you can identify the marks that are being described. For example, if they are telling lesser tubercle, greater tubercle, and If you are having good osteology, then it will help you much more in gross anatomy, because it will be very easy for you for the origin and insertion of muscles, how they are directed. It will be very easy if you have done osteology in a good way. Talking about gross anatomy, to study arteries and nerves, what you should do is to make diagram so that it is very easy to remember the origin, course, branches and termination of arteries and nerves. Now, to remember the muscles, their origin, insertion, nerve supply and action, you should read and revise such kind of tables. How much more times you can do this? By doing such tables, most of your gross anatomy portion will be covered very easily. But one thing is to revise it as much time as you can. Further in gross anatomy, to remember and study the soft organs like liver, testes, heart, lungs, etc., dissection will be very useful, because by dissection in cadaver you can see the organs, where they are located, what are the relations of the organs, what is the composition. All these things can be done by doing dissection. Thus, dissection will be very useful in the study of gross anatomy. So friends, at the end, I would like to give you certain tips to study anatomy effectively. First thing is to revise. When you are done with any topic, you should not leave it, but you should revise it again and again. By doing so, you will see that your time consumption for that topic will get reduced and the topic will get converted from your temporary memory to permanent memory. Another point is, when you are studying in group, what you should do is ask your friends to learn any topic and describe it to you, and the same thing should be done by you. By this way, you can remember many topics within short time, and it will be remembered to you for very long period, because when you are explaining any topic to someone, you will understand it in better way. Another way to study and get more marks in anatomy is to draw and practice as many diagrams as you can, because by diagrams your concept will get better and you will be able to understand the relation in a better way. Another thing is to learn and write clinical applications, because applied anatomy is very important part in our studies, because at the end we want to become a doctor, and so it is very important to know that the things and the knowledge that we are gaining today from anatomy, how we will use it in our clinical practice. So at the end of every question, we should write the clinical application of that topic. Friends, if you find this video helpful and got any good thing from this, then please like this video, share it with your friends and subscribe and press the bell icon. Please give this like to the videos and share it, because it promotes me a lot. Thank you.